Birth Suite, how can I help? Okay, Katie, well, my name is Tiff and I'm one of the midwives working today in Birth Suite. So you said your contractions have become more regular and much more painful? Have your baby's movements in the last 24 hours been normal for you? Have your waters broken or do you have any blood coming from your vagina? And how often are your contractions and how long are they lasting? 4 contractions in 10 minutes lasting for 45 to 60 seconds is great, Katie. How is your pain? Okay, would you like to come into the hospital and we can do some checks and see how you're progressing? Wonderful. We'll see you and your partner soon. Best to bring your hospital bag too. Katie is in established labour, so as her midwife, I want to create a supportive birth environment that will help promote physiological labour and birth. It is important to consider the following. Space. By pushing their bed to the side and raising it will promote freedom of movement and help Katie to remain active and mobile, to assist with gravity and allow her baby to descend further into her pelvis. Comfort. Non-hospital blankets and pillows can help emulate a home-like environment and bring calmness and familiarity. Mobility. A birth mat placed on the ground can encourage an all-fours position and relieve any leg pain or fatigue during labour. A birth ball can promote a squatting-like position which can reduce back pain and aid in fetal oxygenation. Hydration. It's important to stay hydrated during labour to avoid losing concentration, energy and the ability to cope. Encouragement. Affirmations and continuous support can help to reaffirm Katie's sense of control and innate ability to birth her baby. Dim lighting and privacy can help stimulate oxytocin release and suppress unnecessary neocortex activity. Warmth. Comfortable room temperature and warm compresses. For women labouring in water, monitor the temperature of the woman and the water hourly to ensure that women are comfortable and not becoming pyrexial. The temperature of the water should not be above 37.5 degrees. Women may also choose to play music or burn essential oils to promote additional calmness and serenity to the birth space. Checking emergency equipment prior to Katie arriving at the hospital is vital. It ensures that all necessary equipment is working effectively in the event of an emergency during labour and birth. I have reviewed Katie's antenatal records and are aware of her birth preferences, support person and any psychosocial or emotional factors that may influence her labour. Katie has now arrived at hospital and was greeted by midwife Tiff and invited into the assessment room. Katie's blood pressure, pulse and temp were taken. A urinalysis was done and Katie has reported normal fetal movements in the last 24 hours and all maternal vital signs are within normal limits. I gained Katie's consent to perform an abdominal assessment and ensure that she has voided her bladder. I advise her that if she feels unwell at any time or the contraction starts to please let me know and we will stop the assessment. I wash my hands and Katie exposes her abdomen. I locate the top of her fundus and measure her fundal height. I start with fundal grip and move to lateral palpation. I perform Paulick's grip to determine presentation and deep pelvic palpation to assess descent. Using a handheld Doppler, I auscultate the fetal heart rate and listen for any deviations from the normal. The fetal heart can be anywhere between 110 and 160 beats per minute. I record my findings and advise Katie that her baby is in the optimal position for birth. In between contractions, I show Katie and her partner the birth space and all the options she has for labour and birth. Katie yells,
Wait, I'm having a contraction.
I gain Katie's consent to palpate the contraction, which lasts 60 seconds, and then continue to auscultate the fetal heart for 1 minute whilst feeling maternal pulse to differentiate between them. I continue to offer one-on-one continuous support and reassure her that she is progressing well and that her contractions and pain are purposeful. I ask Katie about any pain she's experiencing and tell her about non-pharmacological options as per her preference sheet, including massage and acupressure, movement, warm compresses, water immersion, aromatherapy and breathing techniques. I would also take this time to show Katie's support person how to help support her best while I document and record all findings. I have listed some additional support I would offer and assessments that may be performed in established labour. Please note that the use of a CTG was omitted from this assessment and monitoring as Katie is at low risk of complications and there is insufficient evidence that supports the use of CTG in active stage of labour about whether it improves outcomes or results in harm for women and their babies compared to intermittent auscultation alone.